Welcome to Dishin with Dana. This podcast is all about people who chase what they love and somehow turn it into a reality. From bold ideas to unexpected paths, every guest brings stories, risks, and moments worth sharing. You never know where the story will lead. Pull up a seat, let's dig in. And welcome back to another episode of Dishin with Dana. Today I have a really special guest, Dr. Marco Ferrucci of the Chiropractic Source. He knows a lot about my back, and I wanted to talk to you. Hello, welcome.
For having me. Thank you.
First, let's get into how you started in chiropractic. I don't know. What would be the right term for it?
Chiropractic.
Chiropractic? Okay.
Yeah, we're doctors of chiropractic.
Oh, okay, cool. I feel like there's another word that should be
it's like a
going on.
DC, Doctor of Chiropractic, MD's medical doctor, DC's Doctor of Chiropractic, DPT's Doctor of Physical Therapy, so it's whatever specialty.
See, I don't pretend to know everything.
So just chiropractic.
Yeah, gotcha. So we were just talking, you went to William Paterson, actually.
I did.
For that, but, for
Exercise science, yeah.
Which is really cool because I was going to ask you, was this all you wanted to do, or you kind of wanted to be a personal trainer
Correct,
first, right?
Yeah. So, I've always been into fitness.
Mm-hmm.
I've always been into the human body. In fact, when I was in high school, I had a mini gym in my garage that I would work out in, and I would also train some of our friends. So, I always just naturally liked to help people, and I had a really interest in the human body. So when I went to William Paterson, I was studying exercise science, thinking I was going to be the greatest personal trainer in the world.
Heck yeah.
Until I learned about chiropractic. Because chiropractic, once you understand it, it makes sense, especially if you're somebody that wants to help people become healthier. And we're going to guide ourselves into that and why. But once I learned about it, so a really close family member of mine has been a chiropractor for 30-something years. When I was a sophomore at William Paterson, he invited me to his office. He used to practice he still practices in Pennsylvania. And he invited me to his office for a weekend. He's like, come to my office, hang out, see if you like it. And I just hung out for the day. I was a 19-year-old sophomore in college, and I just kind of walked around, saw how he conversed with his patients. I saw that the patients were happy and healthy, rather than going for sickness. Yeah. Because my experience with, doctors was if you didn't feel well, you went to the doctor. It's like you're going to them when you're not feeling your best. Where these people were going to be their best. And the vibe just grabbed me. And then he taught me what is chiropractic? What's the theory behind it? And I never really jived with the medical route. I didn't like taking medicine when I was younger. Yeah, even if I was sick, and my mother would say, oh, why don't you go take an aspirin, or let's go get you some antibiotics. Just inherently in me, I was like, nah, I'm good. I'm going to be fine. My body will heal. And maybe that was just me, innately understanding that the body heals. So when I learned that you can become a doctor, help people, and you don't have to use medicines, injections, and surgery, that grabbed my attention. And another interesting piece that a lot of people don't realize is I actually love children, and I wanted to be a pediatrician.
Oh, wow.
But again, didn't jive with the medicine. So when I found out I can also help children become healthier and happier without medicine as a chiropractor, then I was like, oh, this is the best of both worlds. I can help the kids. I could help other people's lives, but do it naturally. And when I learned about that, that grabbed my attention. So I kind of veered off the track of exercise science, although I finished the degree to get into chiropractic school. But then that solidified to me that once I graduated William Paterson, I went directly down to Life University.
Oh, wow. And that's
Georgia,
where
I studied.
Right?
Yeah, that's in Marietta, Georgia. And that's where I studied chiropractic. And the rest is history.
Yeah.
And I've been in business now. We're in business 16 years.
Wowee. Okay.
Yeah, it goes fast.
Yeah, it's
we were just talking about it a minute ago. We're like, I can't believe I'm out of college for 20 years.
Oh, God. I know. It's so wild.
That's insane.
I know. Same with me. I
feel like I
10.
just graduated 5 years ago.
I was just texting my friend last night. I was just we were talking about 2015, and I was like, dang, that was 10, 11 years ago.
Yeah.
Where did the time go, you know?
Fast. And the pandemic definitely took a lot more years.
Oh my goodness, seriously, because it's 2020.
It's like a blip in the matrix right there.
Yeah, because like literally 2020, you're like, oh, my dad said it the other day. He's like, oh, that was like 2 years ago. I was like, Dad, it was like 6 years ago now.
Yeah. Oh, yeah. I always add like 2 or 3 years to whatever people say. Like, you realize it's probably about 3 more years ago.
Yeah,
like,
yeah.
Yeah, you're right.
Yeah, you're like, I don't know why. I guess we were just sitting inside all day. That's why.
It's just a blip in the matrix is what I say.
Yeah. That's crazy. So, okay. So you and your cousin founded the Chiropractic Source.
Correct.
In Cedar Grove. We're in New Jersey. So if you're not in New Jersey, sorry.
You're missing out.
You're missing out. But, you know, so like talk about like why you wanted to start that business. Like what was like, I mean, you could also work at a different chiropractic office, I assume, and stuff, but why did you want to start yours? I mean,
it's a great question. So our style of chiropractic is very unique and different. Mm-hmm. Like as
I've noticed that too, yeah. Mm-hmm.
You know, we do what's called chiropractic biophysics, and it's a postural corrective approach to chiropractic. So having that specialty, like going to work for another doctor, didn't make sense because then I would have to try to learn their system when my system that I've been studying for the last, you know, at that time, 5-6 years, it only made sense to go, you know, do it on our own. Plus, I have that entrepreneurial spirit. Like, I wanted to do it. I know I could.
Yeah.
You know, Dr. Tim, my business partner, who's my cousin, he was still finishing up school. So we decided together, like, obviously we'll go into business together. I started the first 2 years. He was finishing up his degree, and then he joined me after the 2 years, and now we've both been in practice together for about 13, 14 years.
Wow.
It was a brave move because a lot of people, you know, don't have that, like we said, entrepreneurship to want to do it themselves. They might not have the confidence in themselves, and I've come a long way. I wasn't as confident as I am now when I first got out of school. So I learned on the job. Mm-hmm. You know, I always joke around. I was like, I learned all the things in the first 4 to 5 years of what not to do.
No, jeez.
And then now, after, you know, 15 years, we kind of got a good knack of it and understand how it works. So now I just, you know, try to now share the message as much as I could versus trying to figure out, like, how do I build a business?
Yeah.
And this is why I'm, you know, taking these opportunities to share this message, because the message that we're going to share today, everybody needs to hear, but they're not hearing it enough.
Yeah.
Especially from their doctors, because unfortunately, medically trained doctors come from a pharmaceutically driven model. Mm-hmm. Nothing wrong with that, but that's not healthcare. Mm-hmm. That's emergency sickness care. So if you model your health care on a sickness model, you're always going to be in sickness. So the model of healthcare has to come from a different mindset, and that mindset needs to be based on healing and not feeling.
Yeah.
And that's a huge differentiation, because you could feel completely fine and die of a heart attack tomorrow. So when you think about how the body heals, that's where chiropractic becomes so valuable, because then we could take this conversation a little bit about where does healing come from, and then that where is the understanding of why is the spine and nervous system so important to your overall health. Yeah.
And so what's biophysics or like the whatever?
So chiropractic biophysics.
Yeah.
I mean, they call it CBP for short. Mm-hmm. It is a chiropractic model that understands what the normal structure of the spine is supposed to look like. I mean, if you think about anything in healthcare, there has to be a normal in order for you to understand what abnormal is.
Do you ever meet someone with a normal spine?
Yes, but it's very rare.
Oh, man.
I'd probably say in my 16 years, I've had maybe 3 or 4 people come in, and I looked at their x-rays, and I'm like,
wow,
I don't know what you did, but you did a good job.
Wow.
And we're going to continue that way.
Yeah.
But the majority of the people come in with bad postures, number one, because they're not being told that their posture has anything to do with their overall health. Mm-hmm. And number two, there's so many things we do in our life that destroy our spine. Mm-hmm. Just think about the technologies we have. Computers, cell phones, televisions. That has now brought us to this flexed posture.
Yeah.
So when we have this flexed posture and your body starts to remember that as normal, that becomes your posture. And we'll see, you know, today we got some x-rays that we might be able to show. But the most common posture that we see come in the door is that forward head posture. Just because we do so many things in that position. Sleeping.
Everyone's like looking like that.
Yeah,
too.
So it's just destroying our posture, but you don't realize that every day is affecting your overall health just by the way the body heals. So, yeah, it's a valuable conversation, and we have to keep it in the healing conversation if you want to truly be strong and healthy for a lifetime.
Yeah. And so CBP.
Yeah.
I'm trying to be all technical
Yeah.
now. CBP. So, like, is that kind of, does it mean, like, it's, you know, like chiropractic, I guess, like, chiropractors, people just usually think they crack your bones and you're out.
Yeah.
Is the CBP, is that more of, like, you're doing more than just cracking bones?
Correct.
In quotation marks,
Correct.
basically?
Well, just think about the foundation of chiropractic. Chiropractic was founded over 100 years ago. The foundational understanding of chiropractic is that when you have misalignments of the spine or the vertebrae, you put stress on the nerves and or the nervous system that decreases your body function. So that's like the foundation of it. Where CBP becomes unique is CBP, the founder of CBP, his name was Dr. Don Harrison. In the early 90s, he was the first person that actually researched to find out what is the true normal spinal model look like.
Oh, wow.
So like for the first, 80 years or whatever, wherever how long that beginning was, they really didn't have like a normal model. So when he created that norm, how we have to be nice and straight from the front and there's natural curves in our spine from the side, once we had that model, now when you treat somebody, you say, okay, well, we're going to evaluate you, find out if you are on that normal model. If you are not on that normal model, we work with you not just with adjustments, but we work with you with adjustments. We work with you with postural exercises. We work with you with something we call postural traction. And all of those three things are there for a certain reason. The adjustment is for your joints, to get your joints mobile, to decrease some localized stress on those nerves. The exercises are for your muscles because your muscles attach to your bones to move your body. But the very big unique part of it is the traction. So the traction is a sustained stretch that we do for up to 15 minutes to remodel the ligaments, because your ligaments are the strong soft tissue that keeps your bones in place.
Yeah.
So the good part is it keeps it stable. The bad part is if it's keeping you stable in an abnormal posture, now it's keeping you in abnormal.
Yeah.
So you have to do traction with the exercise, with the stretch, with the adjustment, to really create this rehabilitative approach. And that's what makes our office so unique versus other chiropractors that are just adjusting the spine.
Interesting. Yeah, because I've been to other chiropractors before, and nothing against them or anything, but
Yeah.
I just like feel like, I don't know, it was just constantly just cracking my bones, and that's how.
I mean,
I like that you did the stretches and you do these different things, which are, it's interesting to me.
Yeah. I mean, don't get me wrong. A chiropractic adjustment is extremely powerful for a human being.
Yeah.
The downside is it defaults back to what your posture is. So I always think of an adjustment like a boost to your nervous system. Think about when your car is dead and you get your jumper cables.
Yeah.
You put the jumper cables and you get a jumper cables and you get a boost to that battery and then it starts working again.
Yeah.
So it's every time you get adjusted, it's like that jumper cable to your nervous system. And that lasts for about 12 to 24 hours, which is why people feel good after adjustment. And it usually lasts for a couple of days, but then all of a sudden it starts to kind of go back to that default posture, which is why the posture is so important to work at. Because if you're only getting adjusted and you're not correcting the posture, then you're staying at norm. You're staying at a status quo.
Yeah.
And if your status quo is in the wrong position and you're putting stress on that energy trying to heal you every day, you're actually trending towards sickness and disease more than in a healing state.
Interesting.
And that's where the conversation of going into health is energy is a valuable conversation for everybody.
Now, question, because when I was a kid, I would do this with my knuckles, ASMR.
Yeah.
And my grandma would be like, don't do that,
It's a complete myth.
But okay, because they always say, like, don't crack your bones. Even my boyfriend, like, don't crack your bones.
Yeah.
I'm like, you're come on, fix your back and then talk to me.
I would agree. When it comes to the spine, it's not wise to crack your own.
You were telling me I shouldn't do that.
But like your hands, your fingers, etc., that's just some stress in the hands that's not going to be as damaging to the body.
I crack my jaw.
I mean, think about it. When you get an adjustment from a chiropractor, you're in hopefully in a relaxed position.
Yeah.
So when they're adjusting that joint, there's no tension.
Yeah.
When you're doing it, you're using your muscles to do it, so there's tension.
Yeah.
So you're actually having a higher risk of injuring yourself than having somebody professionally do it.
Okay, I won't do that anymore. Speaking of terrible backs,
Yes,
let's get into
some
it.
Spines going here.
Well, this is the neck. Hold on. Let's go to the full one, right? What do you want?
Let's go to the side of just the neck.
Side of just the neck. Let's go to the most terrible one.
Right there.
There you go.
Because this is a great one to talk about first. Because we have to think about where does healing come from. Mm-hmm. And if we take a step back and have a conversation about life.
Yeah.
Would you agree if I was to say that the quality of your life is completely dependent on the quality of your health?
Oh, I would definitely say that. Yeah, for sure.
Because if you don't have good health, if you can't do the things you do on a regular basis well, then your life is affected.
Yeah.
So now with that connection, then you have to say, all right, well then if the quality of life is dependent on my quality of health, what is my quality of health dependent on? How do you know you're healthy? That's the next level question that nobody's talking about. And that's the conversation we're about to have right now, because if you think about it, your health is completely dependent on the energy that flows from your brain down the spinal cord, off the spinal nerves to every single part of your body. So if your health is dependent on energy and your life is dependent on your health, then we could deduct from that the quality of your life is dependent on the quality of energy flowing through that. Would you agree on that?
Yeah, I would say so. I mean, that's why I thought it was so interesting, because you were saying like how the spinal cord, and before I even told you the issues that I had, whether it was migraines or I don't know what else, everything, the autoimmune, like poor circulation. I remember you looking at my spine and you're like, do you get migraines a lot? I was like, yeah, kind of. It's like when you go to a psychic, right? You don't want to tell them everything, so you kind of let them guess, right? Yeah. You're like, oh, like, what's your name? Like, I'm not gonna tell you nothing, like, But then you're like, well, how about this? Like, do you have poor circulation? I remember you said something like really hyper specific to me, and I was like, dang. It's like when the psychic gets it right or something.
You're like, darn it, you knew it.
How'd you get that?
But it's not like I am a psychic or anything.
Yeah.
It's literally when you understand.
Psychic chiropractic.
Yes, that'd be awesome. Maybe I should start saying that.
Yeah,
Maybe
right?
I am a chiropractic psychic. But when you understand where the nerves travel from the spine to the body, you understand where it dysfunctions. Because if you think about what abnormal posture does to your nervous system, it's like taking a dimmer switch. Like imagine this green line is the curve that's supposed to be in your neck. Yeah. That red line is where your neck is going. So you have a straighter neck.
Yeah. For anyone that's not looking at the podcast, my neck is terrible. It's just straight. It's supposed to be like a C.
Yes, exactly. So, but what that's doing to the spinal cord is, think about it, it's putting tension on it. But in addition to putting tension on it, it's also decreasing the energy flowing through there. It's like taking a dimmer switch on a light and decreasing the light. The light in the room is going to be less. Yeah. So the energy going through that is going to be less. Now, where that's important to health is wherever that energy goes, that part of your body is going to dysfunction and eventually disease. So when I asked about your migraines, I said, okay, you have a straight neck and it's forward in its posture. The most common thing we see with people with that posture is headaches, migraines, dizziness, vertigo, because the nerves out of the upper neck travel up into our head, face, and throat.
I always just say that, like, I feel like all my worries and problems and qualms are just the base of my neck or like the base of my head. But so we were talking about this too, and then I brought my dad in, and he had a pretty terrible neck, just like me. But first, before we get into my dad's neck,
let's stay on topic with you.
But how does one get a neck like that? Like, so I was talking to my dad the other day. We were talking about sledding, and there was one time, like, I don't know, 10 to 15 years ago, I went down, the area, Morgan's Farm. Yeah. Have you ever been that area?
I've heard of it.
It's like a big drop of a sleigh, like sledding hill. And I went down and I didn't see that someone built a jump, and I was down going on like the tube. So it was like the really fast thing, and I went up. And my face hit into the snow. Oof. And I like scorpion behind my neck and out. And then I was like on my knees, like, when like if you do like a stretch or something, I guess for your quads, you would be on your knees and then you lay back. Like I like I did a scorpion and then I fell back like that.
Yeah.
And my boyfriend at the time thought I was dead because I was definitely concussed for sure, no doubt. But like, could that have been part of the reason?
100%. So our abnormal posture doesn't come from one thing.
Okay.
It comes from our habits since we were a child.
I was in a car accident too.
Yeah. And if you think about it, so there's an interesting thing to understand about our overall health is we mimic our family.
Yeah, that's what we were going to get into too.
So we call it generational patterning. Mm-hmm. So you mimic your mom and dad.
Absolutely.
Your mom and dad mimicked their mom and dad. So we have these generational patterns of abnormal posture just due to the fact that we admire our family and we want to do similar stuff to them, like them. So we sit in similar ways. We move our body in similar ways. We might either exercise or lack of exercise because we learned from them that it's not good. So we mimic a lot of those patterns that put us in these abnormal postures. Then you compound that with traumas, accidents, injuries, falls, the way we sleep. Believe it or not, sleeping pattern is huge.
The whole thing.
Because there's 3 different ways you could sleep: on your stomach, on your side, and your back. The worst way is the stomach. Stomach's probably one of the most popular ways people sleep because you immediately take out all the normal curves in the spine. So now when you're sleeping 5, 6, 7 hours a day, you're sleeping with your body in the wrong position, and then your body molds to that. Just like we're trying to mold it back to normal, your body does a really good job molding to abnormal if you keep doing the same repetitive stuff. Then you get a job and you're working at a computer, and you're at a computer for 8 to 10 hours a day. And you're sitting. Now your body's molding to that. So when you're sitting in these positions and moving in these positions for a long period of time, that micro trauma then becomes a macro trauma or a big trauma, and it becomes abnormal posture. So there's not one thing that causes abnormal posture. It's actually our life.
Yeah.
And if you're not taught that you have to care and correct your posture, then it's only natural that gravity wins over you.
So do you think my neck was always like that straight? Like, you think I was born with that?
It's possible. Maybe not born with it.
Yeah.
But it's possible it started at a very young age.
Yeah.
That you weren't in a chiropractic family that said, hey, let's take care of your spine early. Because, I mean, I'm a father. I have 2 beautiful children. I've been adjusting them since they were 2 weeks old.
Wow.
And I still adjust them, and one is 6 and one is 3.
You check their x-rays?
I took the 6-year-old's x-rays. I don't usually start x-raying children
early, right?
Unless there's an emergency.
Yeah.
But I usually don't x-ray children until about 5-ish because they have enough attention that they can listen to your direction. Because to take an x-ray, they have to stand still, they can't move, etc. So when they're like 0 to 4, they're kind of they just don't have that attention span.
I'd be curious what their spines look like.
So I did do x-ray. I mean, she had some things we have to work on, but overall, it was pretty good.
Yeah.
But there's a couple things, I mean, because she is on the iPad and she is on the phone. So, like, there are things that are having her do those. So the only posture we saw on her is that she had this posture.
Yeah.
You know, it was a little rounded forward with the head forward, but it makes sense with what she does pretty regularly. But I don't adjust them because they have any problems.
Yeah.
I adjust them because they're perfect little human beings that need to be perfect human beings for the rest of their life.
Yeah.
But that's where the switch of mentality needs to come. Like, people think of chiropractic like a treatment versus a lifestyle. Like, you're always going to brush your teeth, correct?
Yeah.
So that's a lifestyle thing.
Yeah.
It's not like you only brush your teeth when you have a cavity. Or you only brush your teeth when it looks a little yellow or placky.
Yeah.
So that's a lifestyle thing. You're always going to shower.
Yeah.
Right? That's a lifestyle thing.
Hope so again.
Yeah, exactly. Hope so. Hopefully you're going to. But like, when you think about the spine and nervous system, since that's the foundation of all your health and healing, that should be something that becomes a lifestyle. In addition to eating well, in addition to moving your body regularly, in addition to brushing your teeth, combing your hair, taking showers, like, all of those are wellness things that if you switch your mindset and think about chiropractic from a lifestyle point of view to keep you strong and healthy forever versus, oh, I have some pain, let me go to the chiropractor to get adjusted so that I feel better.
Yeah, you want to keep it going.
It's like only going to the dentist when you have to pull out a tooth. But then you don't go for regular cleanings. You don't go for braces. You don't go for orthodontics. Like, you just go when you have the major problem. Of course, you're going to have bad teeth.
Now, what would you say, because obviously this is a topic of conversation, and I know I hear this a lot too, and I've thought about it as well, but like, when people say like chiropractors are like either fake doctors or it's like a hoax or anything like that? Like,
it's an amazing question, and I just had this conversation recently with a patient. If you think about what a doctor is, a doctor is somebody that's been educated enough about a topic where they now could teach others about that topic. That's truly what a doctor is. I mean, if you look at, I think Latin doctor is teacher. So then now when you have somebody that says, oh, you're not a real doctor, first of all, that's an ethical or an identity thing. So they think a real doctor, quote unquote,
is like the pharmaceutical doctor.
Prescribes medicine.
Yeah.
When all it is I have a great enough education where I have now been labeled a doctor of chiropractic, so I can teach and use chiropractic as a service to help people. Medical doctors are trained from a pharmaceutical model. Nothing wrong with that. Just a different model. Now, we live in a world that they've done a very great job of educating our population that we think that medicine is healthcare, which it's actually the complete opposite.
Yeah.
But when you break that apart and say, okay, healthcare is over here, medicine is on crisis care, this model is for your emergency, this model is for your health. So if you have a crisis, I break my leg, I have a heart attack, I was diagnosed with cancer.
Yeah,
Sure,
you
go to that emergency side because they're probably going to help you very well. But as soon as you're out of that crisis, what do most people do? They just go back to the life that got them there in the first place. They don't go to that next level of, okay, well, then how do I prevent this from happening again? And even beyond that, how do I make sure I'm stronger than I am now?
Yeah.
That's where it hits another level. And so if they could just separate the models of medicine is crisis and natural healing like chiropractic is healthcare.
Yeah.
Then you can find healthcare in chiropractic, and then that's where it becomes a lifestyle because in Dr. Marco's perfect world, your chiropractor would be your primary care provider for you and your family. Then if you have that crisis that I can't help you with, then we could refer you to the emergency model.
Yeah.
But it's completely flipped around in our world.
Interesting.
They have your primary care provider as an emergency care. So then you're only going to care for yourself in emergencies. Where that needs to be flipped, and that's where chiropractic is so valuable for your overall health.
So let's go to the full
full
body.
spine one. Yeah, because this is a good one to see because I don't think a lot of people see this. This is a great one.
This one? Yeah.
So if you look at the
Great one.
side of the spine here,
He says great.
which is a great thing to talk about because when you look at
Great
the
and
spine
bad.
from the front view of the spine,
Yeah.
that's when people think that they should have a straight spine, they're correct from the front view.
Yeah.
But when you turn the body to the side, there is a natural curve that we're supposed to have in the neck, mid back, and lower back. So our neck curves backwards, our mid back curves forward, and our lower back curves backwards. And that nice, strong, upright posture gives us strength and stability from gravity, right? Because gravity is the number one thing we are not going to get away from, unless you go into space or go into water, which we're not doing a lot of. So when you lose those proper curves, number one, you lose strength and stability. So if we want to be strong and stable for the rest of our life, it's smart to have a good structured spine, especially from the side view. But number two, which is more important, is it literally puts tension on the spinal cord and spinal nerves. Then you decrease that energy flow going through the body, and then wherever the most stress on those nerves is going in the body, that's going to dysfunction.
So do you know where like certain spots, like you said, like the neck might be more like migraines and like the shoulders might be heart or something? Like I know we have a diagram which will go up, but
so think about it's very simple to explain. Upper neck controls head, face, and throat. So think about like upper neck, you're kind of putting on a hood. So this is all related to the upper neck. So people that have dysfunction in the upper neck tend to see headaches, migraines, dizziness, vertigo, sinus issues, thyroid issues, things that are head and neck related. The lower nerves control our shoulders, arms, and hands. So think of those sleeves.
Yeah.
So you got your hood and you got your sleeves. So the shoulders, arms, and hands is going to be the lower neck. When we talk about the thoracic spine, the mid spine here, the upper thoracic spine is your heart, your lungs, and stomach. Your mid thoracic spine here is your digestive organs. So you got your stomach, spleen, gallbladder, pancreas.
Yeah.
Then when you get lower into the lumbar spine or the lower back, you start getting into the pelvic organs, your bladder, your male and female reproductive organs. And then when you get to the lower lumbar spine, they go into your hips, knees, and legs.
So what's a tailbone?
Tailbone.
Like, what's a tailbone do?
So
Is it pointless?
I mean, it's not pointless at all. So the tailbone is what most people call the sacrum.
Yeah.
That is a part of your pelvic region, and that's connected to your lumbar spine. So that's the base of it all.
Yeah.
So like your neck comes on top of the thorax is on top of the lumbar spine, and then the lumbar spine is on top of the feet. So it all kind of compresses on each other. So when you have the nice upright posture, you're nice and strong and stable. When we have these abnormal shifts and turns, now we're no longer strong and stable. Those nerves are aggravated, your energy is decreased, you're dysfunctioning, eventually causing disease. And that's really where most health conditions start, from an energy problem, not the diagnosis that was given to you.
Yeah.
So it usually starts well before you had the symptom anyway.
Oh, because I shattered my tailbone.
Yeah.
Like
So that's another trauma.
5
So
years
you've
ago.
basically had a lot of trauma through your life, whether emotionally or physically. That's a whole other conversation.
That's more for the therapist that comes on.
But in all reality, we all have trauma.
Yeah.
We call it stress. Stress comes in multiple forms. You've had a lot of physical trauma. You scorpioned,
Yeah.
like you said before.
Well, the
you broke your tailbone.
I
That's
went down a half
huge
pipe.
thing. That's a huge
cool.
thing. Plus, in addition to all the other habits that just compound that.
Yeah.
So that's why micro trauma is a small trauma, macro trauma is a big trauma. When they're both happening throughout your life, you develop abnormal structure.
Now, here's a question about, like, posture, for instance, because I see some people that, like, have such a straight back posture. Like, I'm talking, like, their back looks, like, as flat as this table. Like, their shoulders and back. It's, like, beautiful, really. It's, like, truly, like, just straight. And I'm like, wow, that is a great posture, because, everyone's, like, talking because, like, also I've gotten into modeling, so they're like, back
the
up,
shoulders.
this and that, but I'm like, but my neck is like this, and then my back is back, so, like, I always have somewhat of a curve in my shoulders no matter what.
Correct.
Do you want to have, like, a little bit of a curve, or, like, are the people with, like, straight, like, I'm talking, like, flat board, straight, like, do they have a problem?
They do.
Okay, so
They
I
do,
should feel
because-
better about myself.
Yeah, no, absolutely. And you got to think that having
No
a straight,
offense.
having a too straight of a spine is also an abnormal posture.
Yeah.
So like a lot of people come in, they have the rounded posture.
Yeah, that's what I have, definitely.
But the opposite of that, which is also still an abnormal posture, is they're too straight. So when you're too straight, instead of putting tension on the spinal cord this way, you're putting tension on the spinal cord this way. But you're still putting tension on that spinal cord, decreasing that energy. So think about it less from the structure and more from the energy. Abnormal structure equals decreased energy equals health dysfunction. So it's really more about the energy than it is the actual posture. It's just the posture is that tool that shows us where is the stress on that nervous system.
Interesting, because that's what I was
Oh no, I
thinking
see that
about
all the time. Like in our office, we take postural pictures.
Yeah.
As you experienced. So we take a postural picture from the front and a postural picture from the side.
Let's go to the front.
Yeah.
That's me. There we go.
So these are X-rays, but we also do a digital picture. Remember that?
Yeah. That was
Yeah,
crazy
so we have
too.
an iPad that we take a picture of people's posture from the outside first to start showing where their patterns are, to let them know, hey, it might be wise for us to go another level deeper and find out what the X-rays look like. So we have this abnormal posture. Whenever I see somebody come in that has good posture from the side, with the ear over the shoulders and shoulders over the hips, I say to them, there's one of two things going on. Either one, you have good posture. Or number two, which is more likely because you haven't taken care of your spine for the majority of your life, is you have too straight of a mid-back or too straight of a neck, which looks good from the outside, but still puts tension on that cord.
So what could people do to, like, kind of help their posture and either straighten it out or, like, whatever, make it healthier?
Yeah, I mean, the wisest thing is to, number one, understand what normal posture is and get properly evaluated. Because I see tremendous amount of people that think they have good posture. I see this in the exercise world. I see it in the yogis or the yoga world.
Yeah.
They all say, oh, yeah, I work on my posture in the gym. I was like, all right, let's test that. Come into my office. Let's take some x-rays. And I can guarantee you think your posture is correct until you realize that these curves are in the wrong direction. And now you're compounding that by exercising the bad posture into your body. So when we think we're improving our posture, we could actually be causing more damage than good in the long run. And if you think about most people that exercise most of their life, the tail end of their life is not the greatest.
Yeah.
They're usually really stiff and tight because they've built in such a strong abnormal posture. And it becomes more damaging than good in the long run. So I always like to let people know that if you're going to be active the majority of your life, if not all your life, it is very wise to see if your foundation is strong and ready for that. So when you say, what can I do to help my posture? Number one is find out what your posture looks like in the first place. Because if you don't have the correct posture, then now we can default to, okay, here's the postural corrective exercises you need to do. Because the postural corrective exercises are very different than the exercises that people are doing on a regular basis in the gym. They're not the big muscles.
Yeah,
they're
I have
the
this,
deep.
this
Like
thing.
a wall angel.
Does that work?
A wall angel is a great one,
Yeah.
but just think about it, because your spine has these deep spinal muscles around it, and then on top of it is all the muscles that stack on top of it. So when we exercise the spine, we're actually working on those deep muscles, not the superficial muscles that everybody sees and likes. So like we're not doing a bench
Like
press.
secondary muscles.
It's like
and stuff.
deep
Yeah.
spinal muscles.
Yeah.
So it's more stabilization and movement than it is like these big bench press movements or lat pull downs. Like,
I love a good bench press.
oh, it's amazing for you. It looks great, and it's great for your
feel strong.
ego when you're strong.
Yeah.
But that is actually not helping to correct your posture. In fact, if you are dominant in the strength of your chest and you're weaker in the strength in your back, guess what posture that develops into?
The forward one, yeah. Because that's another thing. I talked to another chiropractor, no offense, but like one time, this is...
I'm not the only chiropractor in the world, I know it.
It's a
I might be
story.
the best,
Yeah.
but I'm not the worst. I mean, not the worst. I'm not the only one.
The only one. But he was saying to me, because like I guess I had my posture like forward, and he's like, a lot of the muscles over here in my chest are very tight.
Correct.
Because it's pulling me forward.
Correct.
Which I didn't think, because I was thinking it was just like, oh, it's my back, and I'm just hunching forward because of it. But it's kind of like the opposite. Or like he did like this like shoulder blade kind of massage thing, and my left side hurt more than my right side, even though I think my right side is the problem.
Okay.
Because he was saying like I'm overcompensating because my right side hurts, that my left side is actually hurting more.
You also have...
Well, that's probably from marching band, I think.
I'm just saying,
convinced.
but when you have that posture, like, so your posture,
I'm
just for people to know, you shift to your left and you
shifting.
tilt to your right. So that in itself is there all the time. It's a nice pose. Yeah, it's a nice pose.
Vogue.
But that's your posture. So your muscles, think about your muscles like pulleys. You have certain muscles that are tighter than
Yeah.
others. So when a soft tissue chiropractor goes in there, they're going to see tightness, but then you have to think, okay, well, those muscles attach to the bone. So we have to find out what the bones look like. Just like a massage is amazing.
Yeah.
A massage will never completely correct the posture because all you're loosening up is the pulley system, but you're not correcting or moving the bony system that's attached to.
I got some nice looking ribs, though, I would say.
You do. They're great.
Yeah, they're good ribs.
They're beautiful. They're just in the wrong position, and they're tilted in a weird way.
Well, I'm convinced with my neck, because I always, like, every 20 minutes maybe, you always see me, like, anyone, no matter what, I try to keep it discreet when I'm, like, in public, but I'll always kind of, like, do, like, a little shimmy like, all the time, because I'm cracking this, like, middle part of my upper back, and, like, I started doing that in high school after I was in marching band, because like one day my back was so tight, and I was like, I have the big bass drum, and I had the biggest bass drum in marching band, because all the guys were wimps. But no offense, whatever. But I would start putting that on, and the harness is not made for a woman's body in the first place either, so that was another difficult
Which
issue.
pulls it forward
Yeah,
like
so
this.
because everything, your hips. My dad actually had a couch that we were getting rid of, and he took all the couch cushions out and put it all over my harness so that it would be easier on my hips, because I had bruises on my hips.
geez.
Yeah, because I was a lot skinnier, so
Yeah.
it was just, I was all skin and bones. It was funny because a lot of people were like, yeah, can I get some of that couch cushion?
Can I get that protection,
It
please?
looked ridiculous. If I could find the picture, I'm going to put it up.
Oh my God,
It's
that's
so
awesome.
funny. But yeah, so I started shifting with that, and so I'm convinced like my neck or like my upper back looks like that because of just me cracking it like that after
It's
marching band,
very possible.
which I still do. So it's
mean,
whatever, it is what it is.
We could probably go through everybody's life and timeline exactly
find
what's
out.
going on and find out where it came from.
Yeah.
But it's less about where it came from and more about now that you have it, you have a responsibility, right? Your responsibility is
Too many
leave it this way
responsibilities.
and just let the body break down over time, or
Yeah.
say, you know what, now that I know this is here, I need to correct that in order to be the strongest and healthiest I could be. Because if we don't, then you're just letting life just take you over.
Yeah.
So
Now-
that's the hard part for some people, is taking that responsibility.
Yeah,
So
it's a lot of time
what's
consuming.
that quote, what is it? Is it Superman?
Is it?
With great power comes great
Oh,
responsibility.
great. Yeah.
So with great power comes great responsibility.
Yeah.
You have the power to be the strongest and healthiest human being that you possibly can
I
be.
want to be.
Then you just
My
got to take that
autoimmune
responsibility.
issues.
But it's
problem.
all the energy, I promise you.
I know. Hey, that's why I'm
all
going
energy.
to you know. And so, I'm trying. But also, I got a standing desk. But for like chairs and stuff, like what would you recommend people that like are like me who work remote or work from home or in an office all the time?
Mm-hmm. Yeah.
You ever see those new like
Ergonomically sound chairs?
Well, like there's one where it's like it doesn't even look like a chair. There's like 3 levels to it, and you can kind of cross your legs and everything. You've seen those? They're like weird
I've
looking.
seen a bunch of different stuff out there.
But what would you recommend? Like, what do you think is
Listen,
the best?
it depends. If you're required to be at a desk for the majority of your day, then a standing desk would be wise. Or even those ones that electrically go up and down.
Yeah,
So like
yeah.
you could sit for a
That's what
half
I have.
hour, an hour. You could hit the button, like stand up, because when you're sitting in the seated position for a very long time, you start to shorten up the hip flexors, you start to stretch all these muscles, and you literally start to change your posture like us sitting here right now.
We're shortening up our hip flexors.
Yeah, we're definitely
Not good.
affecting our posture right now. So when I
Need
get
a
up,
standing
I'm going to
desk.
stretch out. We're going to, we'll have to get you
Yeah,
adjusted, and we'll do all that stuff.
Do it on the table.
Yes, we should show that. Come on, let's
Right?
do that right now.
So what would you say? So like mainly a standing desk.
That would be the ideal way. But if you have no option for that, it's just impossible, then there are ergonomically sound chairs. Like a chair that supports your lumbar curve, or even sometimes you could buy a lumbar support.
Yeah.
That kind of goes around the table. But the chair. But when you have a lumbar support, it automatically brings your posture like this. Because if you see when I'm sitting here, as I go into the chair, my body starts to slouch down.
Yeah.
But if I had a lumbar support here, that support would keep that curve there. So at least it keeps you in an upright posture. And then you got to think, if you're at a desk at a computer, how is your computer set up? That's a whole nother conversation.
Yeah.
Because a lot of people, like, they corner their computer. So now they're working like this. Well, then that's not going to be good. So you have to center it.
Yeah.
So you have to be in front of the computer. The keyboard should be in front of you. The screen should be about eye level.
Should the keyboard be up more, you think?
It should be about 90 degrees in your
90
hands.
degrees. Okay.
So like your elbows should be 90 degrees, your wrist should be relaxed. And then the screen, so if you have your screen, whether it's a laptop or a desktop, the middle of the screen should be at the middle of your eyes.
Okay.
So if it's too low, like a laptop,
Yeah,
that's going to
you're
cause
looking
this. If it's too high, actually, I'd rather you be too high, but nobody puts it up that high. So you want to find that happy medium where, like, my eye level is the middle of the screen.
Now, is there a bed that like can like form your like? Is there one like if you were to lay down and like it has all the grooves for your
It's
curve?
tough. That the bed is one of the hardest things to recommend for people.
Yeah.
I always like to joke around and say it's like the 3 little bears.
Oh yeah. This
So you got a hard bed,
Yeah.
you got a medium, and you have a super soft.
Yeah.
I like to find that happy medium. Find the one in that middle ground. But I always tell people, like, a lot of people think that it's their bed that's causing their abnormal pains and some symptoms.
Yeah.
But I say, I'm sorry to say it to you, but it's the abnormal spine on the bed that's the problem, not the bed on the spine.
Yeah.
So they always change their beds, they change their mattresses, they change their pillows, and they still have their majority problem. Maybe it helps a little bit. Then they realize maybe it's not the bed, maybe it's not the pillow, maybe it is me, and that's where that power becomes responsibility.
Oh gosh, I tell you.
All right, we're gonna change the world with this message.
Yeah, no, I believe it. I believe in it at this point. I think it's helpful, and I think everything is helpful to a certain extent, right? Like you can do all these different types of things, whatever it may be, or if you're taking like herbal medicines or real medicines or this and that, I think all of it is helpful in some capacity depending on what you need at that time, I'd assume. But what do I know? I don't know nothing. But
It's emergency.
yeah, exactly.
Medicine's for emergency, but when you use medicine for lifestyle, that's where it gets wrong.
Yeah.
Like, so if you have high blood pressure and they put you on a high blood pressure medicine, fine.
I want to
Until
look
you
at the
find-
source and
until
how
you
I can
find out
fix it.
why do I have that high blood pressure.
Yeah.
And believe it or not, a lot of people don't realize high blood pressure, that one of the biggest reasons people have high blood pressure is chronic stress. which in the body turns into chronic inflammation.
Yep.
And then chronic inflammation creates higher blood pressure, higher heart rate, etc.
Yeah.
So it's like this whole stress in life causing it. So then you have to figure out, where is that stress coming from? Is it coming from a physical form? Is it coming from a chemical form, meaning that I'm taking drugs or I'm eating bad foods? Is it coming from emotionally? Do I have bad relationships? That's when you really hone in to like, all right, where is the stress coming from? How do we remove that stress? And then that's how you naturally get somebody off high blood pressure medication.
Dang.
Now, I'm not a medical doctor, so I can't tell that to patients, but I could tell them how to live and be healthier. And then if their body naturally starts to decrease that blood pressure naturally, and then the medicines tend to be more damaging than good, then they can have a conversation with their medical doctor of like, hey, this blood pressure medication is making my blood pressure too low.
That happened to me once. Ugh.
Yeah. And then you get lightheaded and you might pass out. Like, that's dangerous too.
Yeah.
But the bottom line is you have to get to the underlying source rather than just treating what's at the surface level. It's like your symptom and your diagnosis is here. It's like that that iceberg that you see the top of the iceberg.
Oh, yeah.
And then underneath it, it's this whole thing. So like the iceberg is your diagnosis. The tip of the iceberg is the diagnosis. But underneath it is this whole life
of things
that needs to be addressed.
Yeah.
That underlying tone never gets addressed really by the medical community. It's more like, here's your symptom, here's your treatment to help with that symptom.
Fix it. Yeah.
And then once you feel better, awesome, I'll see you the next time you're breaking down. And then each time you go back to them, it's a little bit worse because you're becoming more unhealthy.
Yeah.
Because you're not getting to the source, you're only addressing the symptom.
You know who I want to talk to? And I've been trying to get him on the podcast. I was like this close when I was in LA. Dick Van Dyke. He's 100 years old.
Yeah, he did something right.
And he was saying too, he is just like, you know, I think the reason why I lived for so long, or he said something along these lines, that it's because he's always been happy and he tries to never let stress get to him. And I could see that because I feel like stress is definitely a part of it where, you know.
Well, have you ever seen that show, The Blue Zones?
No.
It's on Netflix.
No.
It follows the communities around the world that have the highest centenarians, people over 100.
Oh, wow. No way.
So they went to, there's some places in California, there's some places in Italy, there's some place in South America, and they went there and they talked to the people there, and they wanted to find out what helped you get to this ripe age of 100-something years old. And believe it or not, it wasn't the food they ate. A big majority of it was having a sense of community and movement was the biggest thing. Yeah. Like moving their body.
Dick Van Dyke said
like
too.
You have to move your body every day. Yeah. Go for walks. Go for, exercise, all that. The food was important, but it wasn't primary.
Yeah.
Because
it helps.
And also, if you think about food is so different in different areas.
Yeah.
Like the food that we eat in America, very different than the food that they eat in Italy.
Oh,
which is very different than the food they eat in Japan.
Yeah.
So we're not all even eating the same food, yet there's sections of our United States that have a lot of centenarians. So then what's different about that section? And it's usually they move more and they have a great sense of community. So that in itself community was huge, having a sense of community.
Interesting.
So they were a part of groups that they, saw on a regular basis.
I mean.
But yeah, it's called Blue Zone. Just check it out. It's really awesome.
Check that out because I probably like that. I'm such an extrovert, such, and it's so funny because a lot of my friends are really introverted. Like one of my friends should be like, hey, look, I can't hang out for like the next 6 months. I'll talk to you later. And I'll like literally just check in every so often, and it'll be 6 months down the line, and we'll talk again. Like it's totally fine. I know how that's how she is. Yeah. But it's just like I
just want to be out there.
I want to just be outside at all times.
Yeah.
That's why I also hate sitting at a computer.
Yeah.
But that's whatever.
That's okay.
But so on Dishin with Dana, we ask these core questions.
Sure.
And one of them is the recipe for success. So for you, like what is your recipe for success in business and also in helping people heal?
Okay, so helping people heal is at the foundation of it, understanding how the body heals, which we had a great conversation today about energy.
Yeah.
So if you understand that your healing is an energy and that energy is flowing through your spine, then it only makes sense and it's wise to be strongest and healthiest that you can be to care for the spine and the energy going through that. From a business point of view, I mean, I'm as
an entrepreneur too, you know?
Yeah, as an entrepreneur, from a business point of view, whether it's chiropractic, whether it's cars, whether it's teaching, find what you love to do and then figure out how to make money from it. That's like my favorite thing to tell people. Like if you love to draw, well then figure out how to make money from drawing. If you like to, I don't know, play cards.
Yeah.
Figure out how to play cards and make money. But you have to figure out, because if you love it, it never is a job, it's a passion.
Yep.
And when you're passionate about something, people believe in you, and that authenticity breeds success.
Yeah. Wow. That's great. I mean, it's so true. Because a lot of people have said that kind of thing. So I totally believe that.
Yeah.
So hopefully one day we can all get paid for doing this podcast. Okay, and then after
that little laugh.
I'm queen of that. And then after a full, busy day at the office, what is like your favorite go-to meal or like comfort food? Like, what do you?
I don't know if I call it comfort food, but I just honestly, as weird as it sounds,
yeah,
I love two things, and everybody's like, "Oh, of course, because you're healthy," but no, salads.
Yeah.
As weird as it sounds, and I just love a good steak.
Oh yeah.
I'm such a meat eater. Sorry vegetarians, but I'm such a meat
carnivore.
eater. I'm a carnivore. It's
Yeah.
my lifestyle. But like, it's really interesting that like my mom always used to tell me, like when I was young as a kid, she always said I wouldn't eat a meal even at 4 or 5 years old until I had a salad first.
It's so funny.
It's so weird. So like
the
I
same
just
way.
I like salads, and then you throw some meat on it to make it even better. But like if I don't go for that salad, like just a really nice juicy steak, I just love it.
Yeah. And a steak and a salad. That's literally
perfect
what
together.
I'm having for dinner tonight.
Perfect.
Not even kidding. I got like
Awesome.
4 steaks defrosting because my
Yeah.
boyfriend eats like 3 steaks alone. I'm like,
Nice.
bro, I save some food for me. It's insane, but
That's awesome.
I love it. Yeah, it's funny too. Going off of that, my dad said I was a really expensive child because when I was a kid, we'd go to the like A&P or something near us, and he would be like, "All right, pick what you want," and I'd always go to the lobster.
Oh.
And he'd get a freaking lobster
A full
for me,
lobster
like
for you.
literally at
That's
like
awesome.
almost like every night for a while. Yeah, it was bad.
I mean,
It
as
was great.
weird as it is, I mean, to be healthy, it actually is a little expensive.
Oh yeah, it is.
You know,
which
like
is annoying.
If I mean, just think about it. Fast food is cheap for a reason.
Yeah,
and
it's
then
just it's like particle board
Just a bunch of
food.
So, like, that's where, unfortunately, there is a little expenditure, but you're
Yeah.
investing in your health.
Well, that's what I tell myself now with everything that I spend a lot of money on, which is pretty much everything, whether it's a trip or a podcast or, food or whatever. I am investing in myself.
Correct.
So I don't feel bad. But
There you go.
when is the payoff going to come?
Yeah. Put it this way: if you don't invest in it now,
Yeah.
you're gonna invest in the disease later.
True.
So it's like either now or later it's gonna come, because
Yeah.
once you're unhealthy and that quality of life is now where you don't want it to be, you're going to be spending a lot
Yeah.
that you don't want to spend when you would really like to retire and enjoy life and travel and be with grandkids and all that stuff. But if you can't get off the bed because you have chronic pain
Yeah.
or dysfunction, that's where the quality of life conversation is so valuable, to have it now and not wait till your quality of life is destroyed and then try to fix it later.
Yeah, exactly. Well, that's what I told my dad. Like right before here, I just went and got him his passport with him because we're going to go to Italy. He's going to come with me when I go out there for the Olympics. And I'm like, he's like, well, yeah, but I can't walk. I'm going to slow you down. I was like, first of all, I've been there so many times at this point, which I'm grateful for. But like, I don't need to go and see all the crazy things and run around and do 60,000 steps a day. But I'm like, if you wait any longer, you already can't walk that well. Like, just go. Like,
Sweet.
all right, so we're doing the fast round now.
Uh-oh.
Okay, here we go. This or that. Easy.
shoot.
Get
This
ready.
or that, okay.
Buckle up. Here we go. Posture correction or pain relief?
Posture
I
correction?
know, I figured. That was a warm-up. Morning adjustments or evening appointments? Or like evening.
Depends on your type of day you have. But morning adjustments would set you up for a successful day.
I like that.
Evening adjustments would help you recover from the bad
Lull
day.
you. Yeah, okay, true.
Yeah.
Gym workout or long walks?
I like the gym,
Yeah.
but I also like a long walk. But
Okay. You could pick
cardiovascularly long walk.
Yeah.
Overall health, gym.
gym. Coffee or tea?
Tea, 100%. Iced tea, actually.
Yeah, good.
I'm an iced tea man.
Yeah, it's good. Sweet tea? Love it, even though that's
Not
definitely...
sweet, unsweet.
No, I love sweet. I know. I like tea, too. But
yeah.
Sweet or savory?
Probably more sweet.
Okay.
As much as it's crap for me.
Live a little, you know. Standing desk or classic chair?
Standing would be ideal.
Yeah. Adjustments or decompression?
Adjustments.
Okay. Stretching or strengthening?
Both. Throwing that one at you.
Okay. Let's see. Chocolate chip cookies or sugar cookies?
Chocolate chip.
Okay. Take it.
With peanut butter.
Okay.
Throw some peanut butter in there.
Oh, okay. Well, do you like the chocolate chip cookies that have a lot of chocolate chips, or are you more just like the chocolate chip cookie dough with a few chocolate chips?
I like it as long as it's soft.
Okay.
I'm a soft
like a
cookie
chewy
fan versus a chewy cookie.
Oh, okay.
I mean, sorry, not chewy. Like
crispy.
crunchy.
Yeah. I hate a crispy cookie, honestly. It's
No,
like
I'm
if
a
I want
soft
a chip,
cookie guy.
I'll get a chip then, you know? Okay. Neck care or lower back care?
That's a loaded one, but I'm going to say neck because the energy highway starts up top. So you could affect everything below it afterwards.
Meal prep or eating out?
Meal prep would be more healthy.
Yeah. Okay. Fair enough.
Yes.
All right. Well, thanks so much for coming on.
Your time.
And
this is awesome.
yeah, no, this is awesome. It was great, and I learned a lot more. I'm excited. I'll probably get my back cracked later or something like that. I'll bring my dad in as well.
Right here.
Yeah, right. Like, Gil, set it up.
We'll do everything seated. It's fine.
Right. And we'll post some videos for sure on socials with
awesome.
it. Yeah. But thanks for coming in, and thanks for all that you do. And yeah, we'll be in touch. I'll probably see you this week.
Get you adjusted.
Yeah. Thanks for spending this time with me. Seriously, it means the world. If today made you smile, think, or feel a little more connected, go ahead and follow the show, share it with someone who needs it, and don't be a stranger. Come hang out on Instagram with me at Dana M. Schaeffer. Until next time.
This production was recorded at Ignite Creator Studios, digital media and content strategy. Visit ignitecreatorstudios.com.